That's mine, isn't it? Yeah, that's me there. Thank you so much. It's really nice to be here. Thank you for the invitation. I'm Rob Howden, Director of Public Health at Leicester City Council. In public health, we do loads of training around exercises and the theory about what happens when something really bad kicks off. Obviously, we had COVID for a few years, which was quite real. And we've had some other incidents, but they tend to be mostly kind of theoretical. And then it suddenly happens. And then, so how do you actually put all that learning into actual practice? And what does it really feel like? And what can we learn from that? So that's what I've come to talk about, the kind of reality of how this happens in practice. So this happened last April. I started as director in September, so I was quite new to it really. And what happened was one Sunday, I was pottering about at home, making some soup or something, and my phone went, and it was our emergency planning officer who had already started in a tactical coordinating group meeting that had been set up by the police, following a group of deaths and overdoses that happened on the Saturday and then overnight during the night. So the first thing I knew about it was that this phone call that I got. I wasn't on call, but I just happened to be free, which is one, that was a great bonus, that I just happened to be around and I was near a computer and so on. So I joined in the first TCG. So you learn all these acronyms as well, and then suddenly you realise that they're actually kind of real things with real people meeting and going through a certain process. So it started off with the police, they were chairing it. During that first meeting, we had my consultant in public health who leads on substance misuse was on holiday, so she couldn't join in. But in the county council, we had Joshna, who was the consultant there, who had been invited, and she did an absolutely amazing job. Even though all the cases were in the city, she covered a lot of the kind of expertise and the links to Turning Point because she happened to be around as well. And that was one of the things we learned from this, that when things kick off for real, if you're lucky, people really do come together and really support each other. And that was a really kind of fantastic thing to see, that it actually happened in practice. One of the first things we realised was that Turning Point weren't at the meeting. And it was absolutely essential that Turning Point were at the meeting, but they weren't, because they weren't on the list for the local resilience forum and the partnership. And so they hadn't been invited. Now, fortunately, oops, I've done it again. Everyone else has done it. Why should I be different? So, fortunately, Joshna had Andrea's number and was able to rectify that. So, by the time of the second meeting, Turning Point were there and were absolutely central to the response that we were then able to make. So, that was a big learning point for us as well. Now, the first thing that the police did when they started the TCG was agreed a working strategy. Now, these are often taken directly from pro formas and so on when you're learning about emergency responses. And some of them are fairly obvious, but actually the devil is in the detail around these things. So the third point there around conduct effective, open, transparent and timely investigation. What do we mean by open? How much do the police tell other people about the investigation that's ongoing, and how much do they need to keep to themselves? And actually working out the detail of that can be quite complicated. And then the other one, point number 6, to ensure effective communication both internally and externally to maintain the confidence of our people and LLR across, that's Leicester, Leicestershire and Rutland. So communication, that just all sounds very well, doesn't it? But what do we mean by that? Is that internal communication? Is it targeted communication to people at risk? Is it a press release and it's all out in the open? These decisions are really, really important. And it's the establishment of the TCG and the culture of people being open and cooperative and having discussions around that, which then actually really helped make some really quite difficult decisions. So we had the second TCG on that was on the Sunday evening, and then we had one almost every day for the following week. Andrea then started attending from Turning Points. We went through the working strategy, and Turning Point quickly realised that we needed to do a red drug alert, which they already had kind of in place as a template, just needed adapting and agreeing by the group. And the urgency was to get that out to the users and to the service users and to those most vulnerable as effectively as possible. We then had this quite long discussion about whether to go out to external media, which might have actually got the message out to people who weren't obvious current users, for example. But what were the downsides of that? So the downsides were that we're going to stigmatise people, and people may then go underground and be afraid to come forward and talk about the fact that there was this supply out there. So in the end, what we said was, Turning Point are the experts on this. We want Turning Point, talk to your regional, national colleagues, and we will respect that decision. We'll have a discussion about it, but we'll respect that decision. And the strong view from Turning Point was that we needed to keep it closed, and we needed to have the confidence for Turning Point to go out there and talk to their clients in a confidential way that wasn't going to generate stigma and a lot of unnecessary noise. So that was quite a big one. As I say, we met various times. We were also fortunate that the media didn't pick up on it from any other sources, and which we were kind of quite surprised about, because in the end we had 4 deaths and 13 or 14 people hospitalised through overdoses. That's a potential for a lot of noise out in the area and for the media to pick up on that. But fortunately they didn't at all. So we didn't have the distraction of trying to dampen things down. What we did do was we had a reactive press release available in case that happened, so that we could put a lid on that if that happened. So then it was really over to Turning Point, and I'm going to hand over in a second to Andrea to talk about what they did actually on the ground and how it felt to do that in an actual real response. But we learned a lot of lessons from that. We've just got, at the moment, a final draft report of all the lessons we learned from that. And that was around some of that stuff around information sharing between the different partners. The drug alert system worked really well and was really effective and got to the right people really quickly. Turning Point should have been invited, and they will be in future if there's any future events. That system has now been corrected. And also just learning from the fact that we established a good culture of working together across all the different agencies, which meant that people weren't afraid to disagree or to have differences of opinion, but do so in a way that was respected and could have some of those open conversations. Since then, we've written this illicit drug-related incident response plan, which has taken on board all those lessons and is now the first document that we would reach for if there was another TCG called with a similar incident. And that's the template for that as well. That will be available, and not all areas are actually producing their own reports, but we just had to base it on actual reality rather than just the theory. So with that, I'm going to hand over to Andrea.
I actually wanted to put a picture of the Avengers up here because I really like Thor, frankly. But I thought I wouldn't do that because it didn't seem quite right. So, as Rob said, we were quite lucky on that Sunday. I think the winds were behind us in the sense that we had those connections and we were alerted quite early on that a situation was occurring. I was on call that day, and we'd had a phone call in from our Sunday morning breakfast club saying that the police had been and there's something going on, and then somebody rang from the custody suite saying, oh, something's going on, you might get a call. So very early on, we were able to see that something was happening. And so through the wonders of social media, which I'm not always that good at, we managed to pull together a group of staff that we kind of knew that doesn't really matter what day of the week it is, doesn't matter if you're in the middle of cooking your Sunday dinner, as I was for my mum and sister who were coming to visit, and that we would sort of get together and talk it through and figure out a plan. So very quickly, we were able to pull those people together, have a conversation about who was going to do what, and off we went, essentially. So on that Sunday, there were a few things that we could do, even though, you know, it's a Sunday. We're not really in that zone, but we very quickly got into that zone. So we started making phone calls. So we reached out to agencies that we knew that would be open on that day. So hostels, outreach services, anyone really that we knew might have contact with the people that we needed to reach, basically. As Rob said, we reviewed a already present drug alert. I was quite glad that was already present, and made that relevant and up to date, and that went out not just to service users but also to the PIN. So all of the other agencies, when they logged on that Monday morning, they will have received that drug alert and had that really up-to-date information so that they could then start sharing that as well more widely. Our wonderful harm reduction lead, Jude, over there, willingly went out on outreach that afternoon and evening. So she was out actually talking to our service users, letting them know about the risks, just being there and hearing their stories, because this was a really scary time for our community, actually, and, you know, just holding some of that with the individuals that we were working with. So that was really important. I've flicked over to Monday already. I'm very clicker happy. But anyway, and then obviously, as Rob said, I can't remember all the acronyms for the meetings, but I went to that meeting on the Sunday evening. And I think, you know, again, it was so important that we were around that table, and we were very lucky that those contacts were there and we were able to be part of those discussions, because I do think it made a difference. It certainly helped us to be able to respond really quickly and in the right way. So then, I've gone back again. Clearly, this is not my wheelhouse. So on the Monday, the most important thing was really speaking to our teams, and we have about 240 staff across LLR, so that's quite a big team. So we had some flash meetings. So in the morning, we had some face-to-face meetings, but we also set up an urgent Teams meeting. Again, the wonders of technology these days. So we were able really quickly, by 9:30 on that Monday, we'd spoken to all of our staff and updated them on what was happening. And again, that was about kind of, yes, we've got a situation occurring and we need you to do these things, but it's also about, this is a big deal, and we know that actually you're going to be worried about the people you're working with. We were certainly really worried about everybody out there living this, basically. So there were some really practical things we had to do. We had to check we had enough naloxone, because what we wanted to do is make sure that we were issuing 2 naloxone at every opportunity. We had some nitazine testing strips. We hadn't really kind of started using them that much at that point. Let me tell you, they were flying off the shelves. It was like Christmas. And they were going out. We did loads of outreach. So our teams were basically, if they could get out on the streets, they were. And they were just, as I say, talking to people, making sure that we were as visible and part of that kind of conversation for people. And it was really scary. Those service users, they'd either seen something, been there, held someone's hand, dispensed naloxone, and it was frightening for people. So we did see people coming in and needing to talk to us and just work through that experience. One of the key things, and Rob will know because I sent one of my, I really need this, Rob, emails, was basically us getting that list of the people that had overdosed and had sadly lost their lives, because at the beginning, we didn't have that on that Monday, and I think we knew we needed it. We knew that we needed to be able to reach out to those people. I keep flicking. I'm going to put it down. And we needed to be able to reach out to those people and hopefully make sure we were doing everything to get them back into treatment if they weren't in treatment, to talk to them about the risks of further overdose, because we know if somebody's had an overdose, they're more likely to potentially overdose again. And one of the things when we did get the list, and I understand from other areas, you're not always that lucky. You don't always get that list of names. So we were really lucky that we had that relationship and we could get it. It was clear that sadly the 3 people that had lost their life and the 4th person that was critically ill, none of them were on OST, so none of them were on a script at that time. And a number of the ones that had non-fatally overdosed as well were not on a script. We might have known them, that they dropped off script or they were at a different point. So a big priority was making sure we had lots of medical appointments available so that basically anyone that needed to get on a script, be restarted on their script, we could get that sorted straight away. So it really brought home, I suppose, that importance of harm reduction all the way, but also being on a script. So that was quite a big one. So all I would say, you probably can't see that very well, it's not a very good colour, is it? But never mind. For me, harm reduction, that's the way forward. Be prepared. I can remember, and it sounds so abstract at the time, but I can remember in June 23, standing, talking to our staff team at a staff development day about Afghanistan and heroin supply, and it feeling a little bit intangible, I suppose. And then not long after, we had that awful incident in Birmingham that really brought it home as to the reality of nitazines and the risk that our service users potentially were facing. So we really kind of started training. We started talking about this a lot. And I think kind of being prepared for the worst, hope for the best always, it just gives you that, I don't know, bit of oomph on the day. I would say know your people, know the people, that it doesn't matter what day of the week it is, what time it is, that if they can, they will be involved. And you might want to have a little WhatsApp group or something like that because it comes in very handy. But it's about also having those relationships. We were so lucky in terms of the people that we work with, our colleagues in other services, the police, everybody. It was a really trusted relationship, and it meant that we were part of that discussion and part of the narrative on the day. So that's it really from me. But I want to end, hopefully, with some words from a chap called Paul, who is one of our service users. And at the time, he was rough sleeping when this incident was happening. And he just talked to us a little bit about the importance of him being on a prescription and what difference really that's made for him. And I thought it was apt that actually he finishes my bit. So over to Paul.
What sort of things have I done to avoid an overdose? I've taken naloxone and I'm happy to take it. It's a lifesaver. My worker talks to me about it all the time, and it's a good idea. I've stayed on script. Turning Point have helped me stay on script, to be honest. It's the best thing, as I won't withdraw and score something in a rush. How have Turning Point helped me stay on script? When I was in a tent, it was hard. I moved around a lot, and my worker was always helping me stay on and getting me a new chemist at short notice. They helped me with text messaging, reminding me of my script pickups and if I was okay all the time. I had to come and see a prescriber, and they also helped me stay on script by changing it a lot due to moving around. I could go and see my worker at a different place if I liked, and they even came to see me in my tent to make sure I was okay. Not once was I judged either, and I was treated with respect. People talked to me about my drug use rather than forcing me to stop by reducing my script. I was reassured that this wouldn't happen. I'm now housed in a different place, and if it wasn't for Turning Point, I would still be homeless as well. It was making me really ill. I also have to say that keeping on script was the best thing I could do, and since being housed as well, I reduced my use a bit, and I've trained my partner to use naloxone.